Hello, this is Dr. David Green, CEO of the Ohio Pain Network. Today's topic is, what are the available knee injections for arthritis? Over 40 million Americans suffer from arthritis. It's the leading cause of disability in the U.S. Interestingly, more women than men suffer from arthritis by 20%. The total cost for arthritis treatment in the U.S. exceed $100 billion a year. Between 2000 and 2010, the number of knee replacements in the U.S. doubled. And I can tell you right now, the population of the U.S. did not double in that time period. About 600,000 knee replacements are performed every year, and that number could reach 3.5 million by 2030. 35% of those who have a knee replacement are between 50 and 69 years old. So it's an elective procedure. It's done for a quality of life, and it should only be performed after considerable conservative treatments. It is a very successful procedure, usually. However, there are some significant risks that should be taken note of, and you really should use it as a last resort. So initial treatment should consist of anti-inflammatories and Tylenol, prescription pain medications for times when pain is really bad, exacerbation periods, topical prescription pain creams or patches, physical therapy, and bracing. Now, when it comes to knee injections, there are several different kinds that are being used to date. First and foremost is cortisone. These have been used for decades. Hyaluronic acid is an option, along with the newer regenerative medicine procedures such as PRP therapy, platelet-rich plasma is what that's short for, bone marrow aspirate, and then amniotic-derived or fat-derived stem cell therapy. Let's first talk about cortisone injections. These have been used for over 60 years. They are considered a gold standard for arthritis treatment. At first, they were performed for rheumatoid arthritis. They did so well, they spanned a few decades later over into osteoarthritis. They don't cure anything. It is questionable whether or not they harm cartilage. That has not been definitively shown. It was only definitively shown in small animals. It actually didn't get repeated in large animals. There was no cartilage damage. And then it hasn't been shown definitively in humans. Studies show that cortisone injections have a 75% good to excellent results in the knee, and pain relief can last for months at a time, and then it can be, repeated. So they are considered the gold standard. When you look at hyaluronic acid injections, they've been FDA approved since 1997. Hyaluronic acid is the motor oil that's normally found in our joints natively. It helps with lubrication. So there's numerous trade names now available: Synvisc, Hyalgan, Orthovisc. The product itself is made from rooster combs, okay? Very unique place that it comes from. None of these products has shown superiority, but they've all shown benefit. 80% of patients benefit for over 6 months' time. The theory is that you promote lubrication in the joint, anti-inflammation, and it can help compel the joint to make more cartilage. PRP therapy has come on strong over the last few years. It involves a simple blood draw in the office, and then you take that blood and you centrifuge it for about 15 minutes, and what that does is it concentrates the platelets and the growth factors in the middle layer of what results, and you get rid of the rest. So you start with about 30 to 60 cc's, you end up with about 5 to 10 cc's that gets injected into the painful knee, either one or up to 3 injections over a period of about 6 to 9 weeks. Multiple studies have shown significant pain relief, 70% good to excellent results at 6 months, and the same studies show preservation of cartilage in over 70% at 1 year, and this was using serial MRI scans. Stem cell injections have potential to alter the course of arthritis and not just to mask pain, okay? Differently than PRP therapy, they also include a lot of stem cells. They're derived from either one of 3 places: bone marrow, so you have to have a large needle put into the iliac crest; fat-derived, which it comes from a simple mini liposuction; amniotic-derived, which doesn't come from yourself at all. It actually comes from an FDA lab that has obtained, through a consent, amniotic fluid after a scheduled C-section. There's no ethical issues anymore. There's no fetus. The fetus is fine, right? It becomes a baby. And then you have no embryonic stem cells. These are all mesenchymal stem cells. So studies have shown actually some very beneficial results. 6 months after transplantation, patients' clinical symptoms had improved. and that was maintained between 17 and 27 months. There are no large clinical studies in humans with the bone marrow or fat material. Okay, there's plenty of small studies, but not big ones. The bottom line is that there are various types of knee injections available for relief. All are low risk and outpatient. In combination with other treatments that I've mentioned, they may help delay or even avoid the need for knee replacement. And all these can be repeated at least every 3 to 6 months. Okay. The top non-operative pain management in Ohio is through the Ohio Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 different treatment options with the board-certified physicians. Visit us online today at ohiopainnetwork.com and then call us for more information and scheduling at 888-466-9898. I'm Dr. David Green with the Ohio Pain Network. Your pain stops here.